So today I'm going to talk about thyroid health. I feel like a lot of talk about it more lately than there ever has been. And a big reason is because it's undertreated. And as women, especially, I think that we're starting to show a little more initiative in taking care of ourselves and figuring out what's wrong. And so thyroid is a really important topic for everyone, but in particular, I think women. So I'm going to talk a little bit about what the thyroid hormones are, what they do, and then also how we can either treat them a little bit more on the natural side, or if you have an actual problem and get diagnosed, kind of where to go from there. So these are kind of the basic points that I just mentioned. Thyroid 101, some lab testing, kind of some hidden thyroid symptoms. We call them low T3 syndrome, and then how you can support that thyroid. So I'm Elise. I'm a nurse practitioner. I just joined Alive and Well about 3 weeks ago. So this is fun. I like doing these kind of things and interacting with people. And so my history is in functional medicine the last 7 years. And prior to that, I started out in family medicine and endocrinology as a nurse practitioner. And then before that, I had a couple of jobs as a nurse and kind of stumbled into functional medicine. And it's been the most rewarding experience because I really get to find out the root cause of people's issues and then help them get better in ways that I wasn't able to previously. So a big area of my focus is hormone health. I have an advanced certification in hormone replacement therapy, and thyroid is a really big piece of that. So that is me. And let's just jump right in. So the thyroid is this little gland at the base of your neck, and it does everything. So its hormones regulate your metabolic function. That's the easiest way to describe it. It's one of the coolest hormones because it has a receptor site on every part of the body, and not all hormones have that. So that just means it's involved in everything. So if there's something wrong, it affects every process in the body. So energy production, body temperature regulation, cholesterol metabolism is a big one, brain function, weight management, female hormones, and the ability to ovulate, have regular cycles, bone density, heart rate, blood pressure. I mean, really everything. So when you don't have enough thyroid hormone, that's the most common thyroid condition, or hypothyroid. So hypo being underacting. And so the most common symptoms that people will notice right away would be extreme fatigue, hair loss, weight gain. So think about hypo, everything is underfunctioning, your metabolism is underfunctioning, dry skin, low heart rate, low blood pressure. And a lot of people just generally feel like they have a really hard time getting out of bed, their mood isn't as good, they have no motivation. A small percentage of people won't have any symptoms, but that is pretty rare. So if you're left without enough thyroid hormone for long enough, you'll see metabolic changes like your cholesterol going up, your blood sugar going up, and then that leads to something called insulin resistance, which creates a whole other cascade of metabolic issues. You can lose bone mass. And in women in particular, it usually affects our cycle. So you might not ovulate at all. You might not have a period. They might be really irregular, unpredictable. It can also lead to adrenal fatigue, which I won't get into too much, but it's like a downstream effect on the body where those stress hormones start to get dysregulated as well. So thyroid, again, is just incredibly important for how we feel day to day. So lab testing, this is something that functional medicine, we really dive a lot deeper than the traditional setting. So we do multiple labs, whereas a standard practice would usually do these two. So the TSH and the T4 are the two most commonly ordered labs for thyroid function. So it's the TSH stands for thyroid stimulating hormone, and it's the one that goes from this pituitary gland in your brain that lives behind your eyes. It goes right down to your thyroid gland. And this whole process is really regulated by feedback from the body system. So if the pituitary gland is sensing that there's a good amount of hormone in the body, it doesn't send much of this TSH. But its job is what it sounds like. It stimulates this thyroid gland, that little butterfly-shaped gland, to then send its hormones throughout the entire body. So ideally it stays on the lower end because that would mean the brain is happy with the amount of thyroid hormone that it's getting. It starts to go up whenever your body doesn't have enough of these other hormones I'm about to talk about, the T4 and particularly the T3. So if you have too much TSH, it's kind of the opposite. You kind of have to flip your thinking on this, because too much TSH actually means things are not going well. It means that you are hypothyroid. Too much TSH is basically a stress signal. It's telling your thyroid you're not doing good enough. So the reason that will start to happen is because of these T4 and T3 hormone production. So if everything is working really well, TSH goes to the thyroid, and then most of what the thyroid makes is called T4, and it has to do with how many iodine molecules are on it. So that's why there's a difference between T4 and T3. It's the inactive or the pro hormone to our more active hormone T3. So 80% of what the thyroid makes is in this inactive form T4, and it's by design. When everything is working perfectly, this is a perfect system. T4 goes throughout the body, and then at that cellular level, it converts into its active hormone T3, and that causes the metabolic reactions at the cellular level. So if you make plenty of T4, you really have to be able to convert it into T3 for the body to use it. Ideally, you'll produce a decent amount of T4, stays to that middle to top end. I think people can sometimes get hung up on what's my number. The range is really from about 0.8 to 1.7, depending on the lab that you're using. And some people will say, oh, you're not going to feel good unless you're close to that, 1.4 or higher. And I don't find that getting too caught up in the weeds on the actual numbers the most important part. It's like, are you staying in the middle to the higher end? And then how do you feel? So we have these ideal numbers that we would shoot for, but it's not the end all be all. Just like with everything, we don't just treat a number, we treat the whole patient. But all that to say, we are going to look at the T4. We're going to see what your body is doing with it. And then this hormone is probably the most important in a lot of circles. I think we would all probably say it is, just because it has that metabolic activity at the cellular level. So T4 can convert into T3, and then we make a little bit on our own as well. So it's approximately 4 times more potent than T4, meaning it actually gets the job done. It causes reactions to happen. It gets into the cells. Without it, this is where people will really start to notice the symptoms. It's not really that lack of T4, it's that lack of T3 at the cellular level. So it's not really checked in traditional practices, because the idea is if you have enough T4, it's converting into T3. And now we know, even with a lot of hard research done in the last couple decades, that's not true, because there's an enzyme that converts T4 into T3. And at least 20 to 30 people, or sorry, not just people, 20 to 30% of people don't make enough of it. And so that means whether you have low producing T4 or not, you might not be converting all of it into that T3, so you could still get symptoms. That's what we call that low T3 syndrome. Your TSH and T4 might be fine, but that T3, you're not seeing that conversion. Ideally, this is the one that we really do want to focus on that number maybe a little bit more, keeping it closer to its top end. And that range, again, depending on the lab, is usually about 2.4 to 4.2. And again, that range is different per lab, but usually keeping it over 3, closer to 4 is what we're going to aim for. So this is probably the most important thyroid hormone that we look at. And then the reverse T3 is also pretty important. It is, the name implies what it is. It's the opposite of the active T3. So when you have a T4 molecule, you want it to go down this pathway and convert into the active T3. But sometimes, whether it's inflammation, genetics, you have toxic load, something like that, you might convert it more into reverse T3. And it doesn't do anything. It competes with your active T3 to sit on the cell receptor and just keeps it out. It blocks it. It's like a goalie, is the best way I've ever heard it described. So too much reverse T3 is going to keep your active T3 from getting inside of the cell. And it's often elevated with acute illnesses. That can be something like, oh, I had COVID. But we know for sure in major things like heart failure, massive surgeries, you're going to have a lot of reverse T3 for a while. And that's when it's appropriate. Where we commonly see it elevated in inappropriate settings is those underlying kind of chronic illnesses, chronic stress. especially in women. I'll see it in extreme dieting, extreme exercising, not eating enough calories, adrenal fatigue, you're not sleeping, you're stressed. So we don't want too much reverse T3 in the body. You're going to have some, but we really don't want it to be on its high end of normal at all. It's kind of like we need all of these to be in a good balance. And then these are the additional labs that I always like to do because it checks for autoimmune thyroid issues. So thyroglobulin and TPO antibodies. Antibodies are just your immune system's fighters. So if you get the flu, you're going to make antibodies to that strain of the flu. But when it's autoimmune, you're making antibodies against yourself. And in the case of thyroid, these are the two common ones that we will see with Hashimoto's, if you've ever heard that term before. And that just means your immune system, for some reason, was triggered to fight your thyroid. And it can cause a lot of inflammation. So it then becomes two problems. One, you have this autoimmune side that makes you feel fatigued and run down, and your immune system is just hyper responsive and doesn't work like it should. And at the same time, your thyroid is getting destroyed. So you can't make enough of the hormones that then make you feel good. So then you have those symptoms on top of that. So it's more common in women. It's more common after some kind of stressful or traumatic event like childbirth, because that is traumatic, even though it's a beautiful thing. I've seen it a lot after viral infections, childbirth, and major hormone shifts like menopause. That's when I commonly will see it. And if you have one or both of these antibodies present, a kind of cheesy way that I like to think of it is that this is the size of the army that's attacking your thyroid. And so we do in functional medicine. I mean, you might not ever be able to get them down to zero, but we can actually lower the antibody count, kind of lift some of that autoimmune response off the thyroid, and not only help your medication, everything work better, but just help support your immune system. So those are the big labs that we do, which is a little, maybe not a little, maybe a lot more comprehensive than what your traditional setting would do. And so based on those results, that kind of leads us to, okay, what if you are hypothyroid? The traditional diagnosis would be a high TSH and a low T4. So low T4, again, the assumption is that then you're not converting into enough T3 either. So I like to expand the criteria, and so do people just in functional medicine in general, to where if you have all the symptoms and your labs are borderline on the wrong end, you could still be hypothyroid. And we really term that more of that low T3 syndrome, which there's a slide about that in a second. So it's more about treating someone's overall picture as opposed to these numbers that we're seeing. Because if your T4 or T3 are at that very low end of normal, some people feel fine that way if they have a great metabolism in other areas and they don't have anything else going on in their body. But for most people, if you're on that low end of the T4 and T3, you're going to feel bad. And so that's why we kind of expand our criteria, because we want to help people feel better, and we want your body to work best for you. So really important to have these numbers checked, because these symptoms can cross with other issues. So it could be your thyroid, it could be something else. So low T3 syndrome, I mentioned that term a couple of times, but it's really just that lack of T3. So again, TSH, T4 could be normal, but that low downstream hormone T3, if it's low or borderline low, you're going to feel bad. And then you can still start to see all of those symptoms, not only the weight gain, but the metabolic changes, the changes to mood, changes to your cycle, changes to your fertility. So it can happen for a lot of reasons, but it's usually tied to some kind of chronic stress. I mean, like everything, whether that's something you're doing to yourself with your lifestyle, or there's an underlying issue like mold, chronic insomnia, severe cases, things like heart failure, those major diseases, you're going to see low T3. So that's why we talk about it so much. It's the most important hormone. So how these things can then impact your hormones elsewhere. And so as women, it's kind of what we're gearing this talk towards a little bit. It then on the downstream affects your ovaries. So thyroid hormones, specifically T3, again, my favorite thyroid hormone, it helps with estrogen and progesterone production. And those two are the ones that cycle throughout that month, from the first day you start your period to when you start your next. There's a whole perfect rhythm of what your what your menstrual cycle should be like. Because a lot of times I feel like growing up, I always heard that my menstrual cycle, I just thought of my period. But it's really this whole month-long process, whether that's 27 days or 35 days. Estrogen and progesterone, they peak and they valley at certain points so that you can ovulate, you can get pregnant, you can have all those wonderful things going on. So T3 is kind of an upstream way to support your ovaries. So they are essential for regulating ovulation. So getting an egg healthy and mature so then it can ovulate in hopes of you getting pregnant if that's what you want. Leads to regular cycles. So even if your goal is not fertility, just that regularity, so you know what to expect throughout the month, whether it's I'm going to plan my workouts, I'm going to plan my diet, having that regularity just makes us feel a lot better. So thyroid hormones act indirectly in other places. So like prolactin and insulin and growth factor, all of those play a role with female health as well. So it's like, again, it has its hand in everything in the body. So if your thyroid is off, all these other things are going to be off as well. So T4 and T3 are both vital for uterine, ovarian, and placental tissue development. So kind of thinking, again, more about that fertility side, making your body a really hospitable place. So they act directly on those tissues. That's why it can be one of the most common underlooked signs of infertility in us as women. So gotta have thyroid for your ovaries, gotta have thyroid for a lot of other things like your mood and overall sense of well-being. So really important for brain health as well. Thyroid hormones are very stimulating in a positive way. They help make neurotransmitters. So think serotonin and dopamine, all these things that make us feel good. But then it's also important for helping with the cycle of those down-regulating hormones like melatonin, helping us actually sleep at night, helping the body recover. So even though thyroid itself is a stimulating hormone and makes us feel better and energetic and brighter in our mood, it's also important for sleep and recovery. We need it. It's one of our most important detoxifying hormones that we can have. So optimizing thyroid hormones can have a huge impact on depression, anxiety, your memory, your focus, and really just that overall well-being that I think we all want. So as women in particular, we're asked to do a lot every day, a lot. So it's very important to make sure that something like this, like your basic thyroid hormones, are working really well. And then another thing that we work on too is just making sure that they're getting absorbed, that you don't have other nutrient deficiencies or minor infections or, mold exposure, stuff like that, that would just really prevent your body from even being able to absorb and uptake these hormones. So how can you then support your thyroid? Now, if you have a true diagnosis of hypothyroid, then one of the things you'll probably need is medication. And so I didn't put that slide in here, but I want to touch on the options a little bit. If you have an underactive thyroid and you really need medication, the most commonly prescribed prescription is Synthroid, which is just T4. And for a lot of people, it works fine because you convert into T3 and you feel okay. Your cholesterol and all those numbers goes back to normal. But I end up usually getting the patients where that's not enough. So I tend to, in every patient, I don't say every, I have the exception, but majority of my patients end up taking some kind of combination of T4, which is that levothyroxine or the generic version of Synthroid, with T3. So the brand product for T3 is called Cytomel, so I might use that phrase. It's just easier to say Synthroid for levothyroxine and Cytomel for T3. They're just easier to say. So we could do combination of that you get from your traditional pharmacies. I also do a lot of compounding because sometimes I like to make them extended release, which you have to do compounding for that. Some people are really fast metabolizers, so they need that extended release capsule or powder to make it last them all day. And then a lot of our patients are also on the porcine-based products. So that means it's from a pig. It is desiccated. It's like a dried up thyroid gland, and they have come really far in the technology. So it used to be there's this old kind of stereotype about these medications that their dosing is not accurate, and that is not true. Actually, within the last few decades, Synthroid has had a lot more recalls than any of the porcine-based products. So now you know. But what that is animal-based T4 and T3. Now they're very stimulating, and for a lot of people, that's amazing. And if they haven't felt good on those traditional Synthroid and Cytomel combinations, this can be life-changing. And in some people, it's just a little too stimulating, so we do have to use those other options. But the biggest takeaway when you're treating thyroid patients is you have to find the combination that works for them. There is no one size fits all to treating thyroid problems. And then if you have Hashimoto's on top of that, there's other medication options that we do, like low dose naltrexone, which is a whole other talk in and of itself, I feel like. But so much of what we do, whether someone has the actual hypothyroid or Hashimoto's diagnosis or not, it's what I'm about to talk about. How can you support your thyroid on a day-to-day basis? And the old adage of it comes down to what you put in your mouth and how you move is so true. But then there's other things that you can do on top of that. So lifestyle is a big part, but there are some supplements that can be really good. But first and foremost, you need to know if this is a problem. So I would always test before you try to add on a bunch of things, even supplement-wise, for your thyroid, because you can actually end up making it worse if you're taking certain minerals that you don't really need. So always consult a medical provider. I'm actually opening my books in Dallas, which is really exciting. So you could get on with me. We could do some testing. I love looking at thyroid and hormones. So I would just always say, get your test done so you're not accidentally doing something that could worsen a problem. So on the left is all the stuff that we can all do. You have to get enough sleep. And I know that for some reason in our American culture, we think it's wonderful if people can run on no sleep and they get all this stuff done and they do all the things and they look put together doing it. But I try to get people away from that a little bit. You don't have to do it all. And one of the best things that you can do for all aspects of your life is you can sleep. So I always say 8 hours. I know 7 is typically deemed enough, but I'm a sleeper, so I usually get 8 to 9. But either way, you need to get close to 7 or more hours per night. It's how your body rests. It's how it recuperates. It's going to support your immune system. And it's when your body does a lot of its detoxification, which helps your hormones. So managing stress, again, kind of going back to that American culture of go, 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 we try to teach our patients it's okay to rest and you actually need to. So there's a lot of things that you can do, but it's really about what works for you. Anything that downregulates your nervous system helps decrease those dopamine and cortisol spikes and adrenaline spikes throughout the day. Those are really good to keep us going, but our bodies were designed to have these refractory periods as well. So whatever helps you kind of calm down, like meditation, yoga, sauna. I do hot yoga, so it kind of combines all of those things at once. There's those grounding techniques, like just going outside, putting your feet outside on the grass, getting some sunshine, there's grounding mats, prayer, journaling, that spiritual is so important. But you have to be taking care of your stress, because if you're not, your nervous system is always going to be freaking out. And then you're always going to have too many stress hormones, and then your thyroid's going to be impacted as well. So exercising regularly is also key. I would just say move. Whatever you do or whatever you like to do that's fun, that you're going to stick with. People ask me what's the perfect kind of exercise, and I say, what are you going to do? Because that's where it's going to at least start. So something that gets your heart rate up, something that builds strength. We know that as women in particular, as we get older, a big thing is loss of balance and loss of bone density. So even if you're in your 20s, 30s, starting to get that good balance, good muscle tone really helps prevent disease as you get older. And it's one of those things that just helps regulate your nervous system and your hormone production. So it's not about doing a particular exercise. It's about finding what you like that gets your heart rate up and helps you build muscle. Don't over-exercise though. Think that as women with that do-it-all mentality, we have to look skinny, we have to look a certain way, we have to be put together. It's really easy to get into that mentality of doing too much. So, I think over-exercise means something different for each person. So it's good to have someone that you can talk to about this. Like, this is my routine with my labs. Am I doing too much? But generally, you need at least a couple rest days in there. Eat whole foods and drink enough water. So we have some wonderful nutritionists. We have a wonderful life coach here. So if you're wanting to get more into the weeds with it, They're awesome resources. But at the very basic level, you should eat real food. Not processed, not a lot of sugar. Of course, these things are going to come into our diet sometimes, but the goal is to keep, 80, 90% of your life when you're in control, when you're not, at your mother-in-law's house or wherever you are, where you don't know what they're cooking with, that's fine. But when you're really in control, eat foods that have minimal ingredients. I mean, I feel like we've all heard this, but I love it. It's shop the perimeter of the grocery store for the majority of what you're going to eat. They don't, nothing on that. The fruits, vegetables, it doesn't have labels, so you don't have to worry about it. So eating real food majority of the time. And then water, I like to say aim for 100 ounces because if you get a little less than that, you're still doing a good job. And adding electrolytes in can be really important for hormone balance too. I like the Element brand personally. I know there's a couple of different good ones out there, but that one's pretty salty, so I dilute it a little bit more. But that has really helped with like energy and recovery for me. So it's also good for hormone balancing. So skip the sugar, processed foods, emphasize protein at each meal, plenty of fiber, healthy fats, all the real food basically. And then on the right, we have some supplements that you could take. Now, selenium, it's probably hard to get too much of that. Good multivitamin's going to have it. It's pretty scarce in food sources. The main one is Brazil nuts, which not a lot of us eat on a daily basis. But a good multivitamin will usually have about 50 micrograms, and that's a decent dose. But if you have thyroid problems, we usually say 100 to 200 micrograms. It actually supports the production of their thyroid hormones and then the conversion from T4 into T3. And then if you have Hashimoto's, it can actually lower the amount of antibodies that you're producing to attack your thyroid. So that one can be really good for most people, really safe. Iodine is the one that I would say you really need to know what's going on first because if you get too much iodine, you can actually hurt your thyroid. 12.5 milligrams is pretty low, probably not going to hurt anyone. But again, I would caution before just going out and grabbing some. And most people don't need to take it indefinitely. There's usually a really small amount in things like some multivitamins. But when you get to these little bit higher doses, you want to make sure what's going on with your own body first. So low dose can support thyroid function because iodine is one of the most important molecules for all of our thyroid hormones in the tissues. So just check your levels before you start it. L-tyrosine is in a lot of thyroid supplements, like different brands that have combinations in them. A lot of times L-tyrosine will be in there because it's an amino acid that's a precursor to thyroid hormone production. It's also been shown to be good for neurotransmitters like serotonin, stuff like that. And then the glandular products, so they're similar to what I was talking about with those porcine-based medications earlier, like Armour thyroid and NP thyroid. This is kind of that same idea, but at a much smaller level. So certain supplement brands will take the desiccated thyroid or adrenal glands and at very low levels put them in supplements that you can get over the counter. So you'll get a little bit of those active hormones, not even close to enough to need a prescription or anything like that. But sometimes just getting a little bit of those active hormones and tissue from the animal products, because we're very similar to those animals, can really help if you're feeling more on that really run down side. It is really good for helping boost energy. And sometimes people take it for 3 to 6 months, and then we get a lot of other things regulated in their body, and they don't take it forever. So there are thyroid and adrenal versions of that I've seen help with thyroid function. So those are kind of the takeaways of what you can do on your own. And then that's all I really had prepared right now. So I just wanted to open it up to some